So I'll give you this time for you to work on it as I just make sure that I'm able to access the stream. Excellent. Yes. Yeah, fine. So let me, yes, I can see your post right now. So I suppose there has been a slight delay. That's all right. Please let me know if you can listen to me so that I know you are with me. I want the comments to come by, and that's going to be the only way in which I can interact with you. Excellent. So now there are three statements in this quick quiz. The role play requires a reasonable order. It's not necessary to follow any order, and some role plays require an order. Now think and choose the appropriate answer. Good. I do see all of your feeds now. Moise, Anna, Ali from Libya, Sharon Thomas, hello. Great. So could be a technical snag. Adela from Philippines, hi there. So as you let me know you are there. Shahzad, Gurubni, Shafia, yes. You think that it's option A. Hello, Christy from Nigeria. Hi, Bibin. Sharon, yes. Tendai. Absolutely. So all of you are correct that the role play requires a reasonable order. So that's what we are looking at today, the structure of the role play or a clinical consultation for that matter. Now, many of you know that I don't distinguish much between OET's speaking role play and clinical consultation because it's almost the same. So good to see you, Seema, as well, and Nifta Fleming, hi, IRS. Yeah, good to see that all of you are happy to attend this session from IRS Group. Hello, Rani, good to see you. Good evening, Maunish. Excellent. So let's move on to another question. So let me know, fill the sentence and then choose which of the options would be correct. The structure of the role play or the interview, option A should be kept discreet by the health provider. Option B should be evident to the patient, and option C says does not influence the patient. Hello, Susmita. Hey, good to see every one of you in great spirits. Hello, Wafa. Yep. So can I have the answers for this question? Whether it's option A, B, or C. Hello, Nikhil. Hi, Mohammed. I'm getting a lot of answers, especially options. Hello, Dharan Kumar. B, A, C. So, but a lot of you think it's either B or C, but hi, Suganya. Hi, Shirley. And it's option B. which most of you got it, correct? So the structure of the role play should be evident to the patient. The patient needs to know what is going on and how the role play or the clinical consultation is going to be structured. Like, it should be evident to the patient. So I've got one more question. The healthcare professional should Good afternoon, Devin. I hope all of you are answering the third question. So the healthcare professional should, option A, be flexible to patient needs. Option B, focus on the interview structure. Option C, balance flexibility and structure. Which of these options do you think is correct? I'm getting answers C, A, C, A. Right. Adela, there is no option V over there. I've got all sorts of options, all three options, but the correct option is option C. The healthcare professional, which is you, should balance flexibility and the structure of the role play or consultation. So this is important because traditionally, models have not been so much flexible. So the focus has been mostly into history collection and things of that sort. But nowadays we have moved on to include both. That's fine, Adela. Yes, you meant C. Excellent. So now you have an idea that both the role play as well as a clinical consultation requires a structure. There is a structure in which it should be done. And this is important for most of you as OET candidates to get a great score in speaking and to be great clinical communicators in the healthcare sector where you work. So we will go through some of the finer details of structure, and then we'll be doing a role play. So there's a lot of interaction coming up the way. So that's how today's session is structured. So I'm letting you know overtly what today's structure is like. So now you have an idea that I'll explain a few things first, and then we'll move on to a role play. So why is a structure necessary in role play or a medical interview? All right. So remember that a role play and a clinical consultation are meant to be purposeful conversations. You're not having a friendly chat. There's a purpose, right? And remember two things. You have a set of goals which have to be achieved, and there are clear priorities, right? So these factors should guide us when we think about the structure of the role play. So let's look at the direction of a role play, how it's headed to. So there are two things which will determine the direction. So one is the need of the patient. So the patient has certain needs, and that's why they've come to you. And you, as a healthcare professional, you've got some needs to be fulfilled in the interview. And now, in the rest of the slides, you will see the words doctor or nurse or physician. But remember, it includes all of you, whether you're a pharmacist or a physiotherapist. I just can't write all the professions on the screen. So if you're not a nurse or a doctor, it's absolutely fine. This is for you as well. Just think of your profession over there, right? So let's look at a couple of needs. Now, the patient's needs, what are the patient's needs? Relief from discomforts. Their illnesses have to be cured. They require treatment, medication. All of that is they are the patient's needs. And what's your need as a health professional? So you should be able to clarify the patient's problems, should be able to diagnose, and come up with therapeutic plans. So that's your agenda. Whereas the patient wants his or her problems to be addressed, his health to be back on track. So remember, there are these two things which together should determine the direction of the role play. Okay, so we'll look at some more aspects. And now I'm focusing on balancing. So as a health professional and as an OET candidate, you will have to balance a couple of things. The balancing act is very important, but at times it can be a little bit difficult because you get pulled away by some things and, this is distracting you. And in the OET's role play that can happen, for instance, the patient wants his or her story and suffering to be understood, right? So they are pulling you towards that goal. Whereas as a health professional, you need to understand, much about the patient's condition and treat the patient. So that is your agenda. So a fine balance between these two is what is required, and this is not very easy because you are dealing with people who have a variety of problems, perceptions, and all of that. So learning to balance it is going to improve your OET speaking skills. It's going to make you better communicators. Yeah. So now there is one thing which, if you look at this slide, it is one-sided. There's nothing about the patient, right? So as a health professional, you'll have to balance two things here. One is actively directing the encounter. So the patient's interaction will have to be directed, and you should facilitate the patient's spontaneous reporting. So when you focus too much on the structure, you shouldn't be kind of snubbing the patient or rebutting the patient, or rather silencing the patient, because your emphasis on structure should not come in the way of doing this act of encouraging them to speak. They should be spontaneous, but that shouldn't come in the way of the structure. So that's a fine line to balance. So we are going to look at structure in a little bit detail, but let me know if you are aware of any consultation model which you have heard, which you have studied about, which you have read, which you practice, which is part of your clinical protocol. Let me know if you have any such consultation model that you follow. Okay, so there have been a number of consultation models, which I'm not going to talk about, but I'm going to highlight just one model, which is the Cambridge Calgary Guide. Now, this is something which has been devised in the 90s, and then it was revamped. So today it's called the Enhanced Cambridge Calgary Guide, in order to incorporate the evolving needs of health professionals and patients, and the need to be patient-centered. All right. So you see 5 steps or stages of this model on the screen. Now, if you're familiar with this model of consultation, please let me know. Type in the chat box that you are familiar with it. So that would be really interesting. And I'm curious as well as to how many of you are aware of this, have heard of this, apply this in your practice. That should really be interesting to know. Okay, Nikhil is aware of it. Okay. So some of you are aware of it, some of you are not. So those who are aware of it, excuse me as I explain it a little bit for those who have not been used to it. But probably you are in a way used to it because you do it every day at work. And it could be just that you are not specifically aware of the model as such. Okay. So the stages of this model include initiating the session. Now, just try to remember the OET's criteria and try to compare how closely knit they are. You would be really surprised. So it starts with initiating the session, and then you have gathering information, physical examination. In OET, you don't have a physical examination to do. So from the OET's perspective, we don't require a physical examination. And you don't have to say that either, typically. And then you have explanation and planning and closing the session, right? So this is a typical structure. Now, I'm not saying that every single time it has to follow this model or these steps, but generally, this is how any medical interview would be, formed around, would be shaped. Now, there are two streams of action that go parallel with this. All right, so that's one thing which I want to focus on today. So you see both of them going parallel. One is providing structure, and the other is building a relationship. So as the health professional, as you as a health professional is engaging a patient, and right from the beginning, right from initiating the session to gathering information, and in clinical settings, the physical examination, but in OET, that part is not there. And through explanation and planning, which is information giving actually, and closing the session, as you go on, you should be constantly providing the structure. So the structure evolves, you move on stage by stage, and as it progresses, you are building rapport with the patient. So the patient is getting more and more comfortable with you to disclose his or her concerns and information about the condition as well. So both of this have to go hand in hand, and that is going to be an excellent clinical consultation. You would be really happy when you follow it. Remember this in the back of your head that you have to do both these things. I have to think about the structure. This interview should be structured. There is an order. All right. At the same time, I should empathize with the patient and build rapport with the patient and make him or her comfortable, right? And understand his or her perspective, all those things. So they go together. So when you learn to do that, your OET speaking skills will fly through the roof. You're going to be excellent in what you do. Hope that gives you some cheer, right? So I'm now going to talk a little bit in detail about providing structure. There are two aspects to providing structure. Let me know what you understand from those two bullets that you see next to providing structure. One is making organization overt. What do you understand from that? First is making organization overt. Let me know, tell me what you understand from that, and then we will move on to attending to flow. So what is the meaning of making organization overt? Even in the last session, we were talking about making something overt. And if you remember, I had told what it typically means. Okay, so how do you make organization overt? What does it mean? How can you do that? How will it provide a structure? How will it enhance the structure of your role play, of your interview? Jayanti says priority. Okay, right. So I suppose Christy as well says a priority. So I suppose what you mean is about setting the priorities. Open to view or show, Nikhil. Okay. Yeah, you have to show what the structure is to the patient. In that sense, yes. Yes, good. Rehna says concerns. So, not exactly. I don't get what you mean by concern, but it's not about concern. Sorry. You don't have to be concerned about typing in your answers. It doesn't matter. Can be wrong, it's all right. That's how you learn. And making mistakes is part of learning. So Rani says according to the setting. Right. So making organization overt it means making the organization clear. It should be clear to the patient. Chandi says gathering the relevant information and framing out. Purpose, Irfan says purpose, right? Okay, letting know what the purpose is, right? In a way. Now, sometimes I've seen a few candidates during practice sessions come and just start on with excellent. Cindy says not a secret or the organization is not concealed. Absolutely. So I've seen, this is what I was telling. I've seen some candidates come and, very discreetly ask you some questions. So if you are an interlocutor or if you are the patient, you would be surprised. Okay, why am I being asked those questions? What's the purpose of asking those questions? What is this nurse, this doctor trying to do? Right. So finding out, Adela says find out, then advise, explain, reassure, provide. Yeah. So that's the order, but making it overt means making it clear. And it's always better if at the beginning of a role play or a consultation, if it's clear to the healthcare professional, so to the patient that this is what's going to happen today. Introduce yourself and then set the agenda. These are the things we are going to do. Set all right with you. So I'll be doing this and then I'll be doing this. That's absolutely. So the patient knows exactly what to expect, what all things are going to happen that particular day. So that's what is meant by making organization overt. Now, how can you do that? there are a few things which you can typically do, and one is to summarize. Now, when you hear summarize, you might think it's something that happens at the end. Of course, at the end there would be summarizing, but summarizing happens in between as well. So we will do that a bit later. Excuse me for the long explanations, but I think this is important. So you summarize in stages. So at the end of each bullet of the OET's role play card, or at the end of each stage of the consultation, it's a good idea to summarize. How can you summarize? Give me some examples of how you can summarize at the end of, let's say, a bullet. And why do you summarize? You do it for a number of reasons, but primarily to confirm understanding. Both of you should be on the same page. That's very important. It's not an ideal thing for the patient to have some idea and the nurse, the doctor, or anyone, getting some other idea. That would be really, really problematic. Hazel says, by summarizing in between, it can serve as your transition as well. Excellent. Confirming, Rajesh Chako says, by confirming. Absolutely, yes. You confirm. This is what I've understood. Do you agree with that? Can I have a few more answers, all of you, quickly, to check the understanding? That's Marato Ratti. Yes, to check the understanding of both the patient and the health professional. Nikhil says to make sure that the patient is clear with the explanations. Yes, and you as the nurse or the doctor or anyone is also clear with what the patient has said. So it's important. Clarity is important on either side to know if a message is passed. Yes, Christy, that's right. To know if what you have told is clearly conveyed, the message is passed. Perfect. So I've got a few examples for you. So the example is, so you just said that you find it hard to breathe smoothly at night. It's a bit labored, right? So as a health professional, you have a patient who has complained of breathing difficulty. And so when you have gathered some information, you can ask something like this. So you just said that you find it hard to breathe smoothly at night. It's a bit labored, right? So you have collected some information and you want to check that. Irfan says to make sure that the patient is satisfied with the explanation. Yes. Rana says to check if the message is conveyed. Yeah. To make sure the message is clear to the patient. Victor, yes. Good that we are all on the same page and you are getting the message, and I'm happy about that. Excellent. I've got one more example for you. And it says, all right, this is what I reckon. You visited the farm last week and has caught this cold from that day. So you have a patient who went to a farm and, has a cold, probably had some allergic reaction or whatever. So you're just summarizing that part, and so you just want to, probably the patient didn't explain very well, so you're just piecing together the information which was given as well. Sometimes patients don't explicitly and very clearly tell you, like, this is what had happened. It might come in bits and pieces. Good. So now the second tool which you have is using signposting language, using transitional statements. Now, that's actually another large topic in itself, but I'm unable to, I'm not able to, complete this without touching on signposting because they are so interwoven. You can't separate signposting from the structure. They are built in together actually. So give me some examples of signposting. What do you understand by signposting, and how would you signpost typically? I'd really be happy to get a lot of examples. I hope you have used a couple of them. Could be in your OET preparation practice, could be otherwise. So signposting is actually another indicator as well. So if you look at the OET's criteria, there are two separate indicators provide in the aspects of providing structure. Okay. Nestor says by telling the patient the next thing you are doing. Yes. Nikhil says words or phrases. Good. And I'd like to have some examples which you typically use. Mahesh says, first I'm going to tell, and next. Very good. Meso says the good news is that, yeah, so it's you're giving some good news. Rani says signposting means the patient should understand what is next. Yeah, absolutely. Rana says using phrases. Yes. Hazel has given an example. To administer your insulin injection, you would be needing the following procedure. The first is to, fantastic. So very important point is, so the patient knows you're talking about something very important. Okay. Nikhil says next, then secondly, yeah. Very good. And I've got some examples for you as well. So I want to ask you about your lifestyle. What's your diet like? So that's a transition from something else into information gathering, which is related to lifestyle, right? So the patient knows now that Mohammed says highlighting, yes, highlighting each of the area in which you're passing through. So this is an example or something which you can use, or similar ones. I've got one more for you. Finally, I'm going to explain the medicines prescribed. Is that all right? So this is again another example. Rani says, can we discuss the treatment options? Absolutely. Adela says, ask about how is she managing, intervene in his or her feelings, complaints. Yes, but for that you specifically indicate that this is what you're going to do, Adela. So you will have to say like, I'd like to know how you're managing. Can you tell me something about how you're coping with this situation? All right. Okay. So let's summarize this segment. So parts of providing structure include making organization overt or clear, and that includes two things: summarizing in stages to confirm the understanding, and using signposting and transitional statements. All right, so there's something else as well. So the second part of providing structure is attending to the flow. All right, so attending to the flow, what does that mean? Now on the screen you see one of the aspects of that, which is logical sequence. Your role play and your medical interview should have a sequence. You can't just jump from one point to another. Now, if you're an OET candidate, just think if you always try to follow a logical sequence, or does it happen that you're jumping from one aspect to another and then coming back, and sometimes it could be a little bit messy, lacking organization, because there is no proper sequence. And this is really important because lack of this logical sequence could have ramifications elsewhere. This is not just contained in itself, but it spreads throughout the role play, and it affects your performance if you're not able to. Now, one interesting thing about providing structure is that if you have a very good structure, it's not evident, just flows smoothly. But the moment you lose structure, things start going wrong, and you struggle to bring it together again. All right. So structure is more observable when it is lacking, when it is missing. You know that you didn't do well, especially in OET's context. If you're practicing, or if you have taken the test earlier and you have not really achieved the score that you wanted, probably you didn't stick on to a sequence. It was slightly disarrayed. So it's really, really important. So when you look at it, don't just look at it as something which is going to give me 3 marks and is one of the clinical criteria. No, that's not what it is. This has huge impact on your performance. And so the next aspect of attending to flow is the timing, being aware of the time and keeping on task, which means there are 2 things. In an OET's role play, you've got 5 minutes. So you should be aware of how much time you have got to do this task. I've got 5 minutes. And when you practice probably with your friends or with your teacher, it doesn't matter. As you kind of evolve your practice, you should develop the awareness of time, a sense of time. Now, a lot of candidates tell me we have no clue about time. That's true. But you should be able to know, like, I've discussed so many things. I've covered 3 bullets and I've asked so many questions. So probably I must have reached 3 minutes or 4 minutes. So you'll gradually develop that awareness of timing, which is really important. And equally important is keeping on task. See, in the OET's role play card, you have, let's say, 5 or 6 or 4 bullet points. Those are all tasks you have to do. And if you have a proper structure, you'll be able to cover most of it. Now, I know what many of you are going to ask me, is it important to finish all the tasks? Technically, in the OET's context, it's not important to finish all the bullets. So you're not going to be penalized because you didn't finish every single bullet. But having said that, if you are a very organized candidate, ideally you should be able to finish all the tasks, because you have this sense of time, that awareness of time, and then you know how to stick on to tasks, how much time you would have covered so far. These are the tasks, this is the sequence I'm following. So Seema is unable to join through your laptop. Seema, this recording will be available on OET's Facebook page. You can watch it later, right? Okay, so this is really, really, really important. Okay, so let's once more summarize everything which we have covered from the Cambridge Calgary Guide about providing structure, and we're just going to apply that in OET's context. So you have to make the organization overt. You use summarizing for that. You use signposting and transitional statements for that. and you have to attend to the flow. And so for that, you have to think of the logical sequence you follow, and the sense of time, and sticking on to the task. So I have a role play. Some of you would have done a abridged version of this, but this is the role play in its entirety. So we're going to do that one by one and practice what we have just discussed. All right. Now, we have looked at Cambridge Calgary Guide, but there's another model as well, which is the order of the role play. In the role play, you have the task part, which has all these bullet points. And if you can actually stick on to that order, that's absolutely fine. You can forget Cambridge Calgary Guide. The reason being, OET item makers typically would be following the same pattern anyway. So it's almost the same. Here you find a marriage of the Cambridge Calgary Guide with the order of the role play, and so you see that it's the same thing. Dolly has a question. You have a concern. Is it important to comply the task? Because sometimes there is much more to describe, so a bit difficult to complete the task. Okay, that's what I was talking about. You don't have to worry about being penalized or losing marks because you did not finish all the tasks. But having said that, and I repeat, if you are good at organizing, you will be typically able to cover most of it. So that's what we are going to try and learn. All right, so Dolly, don't worry about it, but try to learn how to organize, how to have a proper structure, and that's what we are doing exactly now. Okay, so we are going back to, this is a summary of the role play card which I showed you. So I'm coming back to that role play, and we are going to have a go at trying to do that. Now, the first bullet is find out how she feels about the upcoming surgery. So this is the surgeon's clinic. The background is a patient with a body weight of 130 kilograms who is scheduled for a bariatric surgery in 2 weeks' time, has come for the pre-op consultation. The patient is anxious about starting the special diet and possible complications. All right. So the first bullet says find out how she feels about the upcoming surgery. Right. So this is initiating the session. Dolly, the things in the bracket are actually guides for you. You don't have to use all of them if it is an example. Examples are given so that you can use them if you wish to. You can use similar examples as well. Absolutely, yes. You don't have, it's not compulsory that you use all the examples. All right. So can you type in how would you respond to the first bullet? But this is going to be brief because the rest of the task items are what we are going to focus on and apply the skills which we have learned today. Find out how the patient feels about the upcoming surgery. Now, we don't expect a very elaborate answer for that. It's just a kind of a warm-up. So you greet the patient and ask them, oh, all right, you've got 2 weeks. And you're welcome, Dolly. So what are your thoughts about the surgery? It's just 2 weeks from now. Okay. Hope you are typing in your responses. What would you ask? Okay. As your answers pour in, Mahesh says, I see that you look anxious. Could you tell me what's bothering you about the surgery? I can see that you're anxious. Would you like to share your concerns with me? If I may, that was Christy. Dharan Kumar says, if I may ask, how do you feel about your upcoming surgery? Is there anything in particular that you're concerned about? Yeah, very good. Right. So, what seems to be bothering you, Manish? Yes, what seems to be bothering you, but we can go a little bit deeper a little bit later, because that was just a warm-up question or task. And here is the first bullet where some real action is going to start. So you have to outline the purpose of the consultation. So this is the second bullet. Yeah, good morning, Mrs. Mercy. You seem anxious. Can I know how you feel about the surgery? That was Priscilla. Very good. Yes. Now, can you all focus on this bullet? Adela says you seemed anxious about your surgery. Are you nervous? Cynthia says you look quite anxious. Could you tell me how you are feeling about the upcoming surgery? Yannick says, I can see that you look anxious about the surgery. Would you please tell me what your concerns are about it? Okay. Right. Daphne says, I have read in your chart that you are scheduled for surgery in 2 weeks. How do you feel about that? Brilliant. Ihoma says, can you tell me how you feel about the surgery, please? Yep. Good. So I'm awaiting your responses for this bullet, where you outline the purpose of the consultation, which is exactly what we have been discussing about, making organization overt, making it clear what all things are going to happen today. And you can connect with the nervousness which the patient would have told you from the first bullet. That's absolutely fine. Could you, Shoji says, could you tell me about upcoming surgery and your concerns? Yeah. Sorry. Okay. Dharan Kumar says, I understand what you're going through, and I assure you that I will help you all of that during the course of this discussion. So let's start with the discussion about what we are going to do in this consultation. Very good, Dharan Kumar. I really like it because you have touched on to what was discussed in the first bullet, and now we are really connecting that and making it clear. Dolly says, good evening. I'm the registered nurse on duty today. You can call me Iram. So you seem to be anxious. Please tell me what's bothering you. So, right, that could be for the first one, I suppose, because, yeah, for the first bullet, that's fine as an introduction. But now I'm looking at outlining the purpose. Looks like all of you are very busy typing. Okay. Now, not every bullet, every role play will have a bullet like this, which asks you to outline the purpose of the consultation. Even if it doesn't say that, it's absolutely all right for you to say based on the other bullets. You can say like there would be find out and then explain, and so you can say that I'll be gathering some information and explaining to you. That's also fine. It doesn't mean that you need a very specific bullet explicitly asking you to clarify the structure. It's not necessary at all. Okay. Ihoma says, I understand your worries and it's normal to feel this way. Okay, but continue that with the over discussion on the structure. Cynthia says, it's normal to feel anxious prior to a surgery. So we will discuss issues pertaining to the surgery. Firstly, we are going to discuss da 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 da. Is that okay? Brilliant, Cynthia. I like it. Nikhil says, firstly, I'd like to brief you about this meeting, that what is to be done before your surgery. I hope it will lessen your anxiousness or anxiety. Good. I'm going to discuss your results, type of diet, plans, and when to see your surgeon. Yes. Mahesh says, I totally understand your concern about your surgery. Let me explain the purpose of the consultation today so that you will have a clear picture of that. Yeah. That's good, Mahesh. So you're getting the hang of it. All of you are really giving very good responses, and keep practicing, this way, and you will get used to it. It will become part of you. So whether you're doing an OET speaking, role play, or a consultation or meeting a patient, you'll always get the hang of this. Rani says it's very obvious to feel anxious, but not to worry, as I'm here to help you with your concerns. I agree, Rani, but you have to say how you're going to do that. You have to be clear about the things that are going to happen, the stages, the steps of today's consultation, right? But many of you have given very good responses, and I'm really happy that you're learning, you're improving. So let's move on to the next bullet, which is reassure the patient that the results from the screening test have been evaluated. The chances of complications are negligible, and that all precautions will be taken. So you're transitioning from a previous bullet point to another one. Priscilla says, next thing I'd like us to discuss in detail about your surgery. Is that okay for you? Right. Okay. So I want to see some transitional statements coming here. All right, now that I've told you something of that sort, and then moving on to this, how would you start this bullet? Dolly says, I understand how you're feeling. Try not to worry, please. I'm here to help you. Definitely will assist you. So let me discuss next plan for you, like your diet plans, some lab investigations, and most important things here, consultation with the concerned doctor. All right, Dolly, I understand what you're trying to say. Yeah, so you put it together, but probably because of the quick typing, it's slightly confusing, but it's all right. I can make it out what you are trying to convey, and that's fine. Just work on it, how you make it even better. Jean says, I know that you are anxious at the moment. May I know all your concerns so that we can tackle before your surgery? Yes. So is that for reassuring the patient that the results are right? I can understand your concerns, but it would be better if you tell me what exactly bothers you. Rani, I don't exactly get which bullet point you're addressing. So is that the reassuring part or the previous one? Okay. Michael says, don't be anxious about it. All your screening test has been evaluated. All you have to do is be ready and everything will be fine. Michael, it's a little bit too direct and blunt. You have to expand it a little bit, but I get the point which you're trying to make, which does make sense, right? But don't be too quick. You'll get over with it very soon. Seema says, now as your test is completed, don't be worried. I understand your concern, but try to relax and all your worries will be sorted. Again, Seema, that's very generic, a little bit generic. You have to be to the point, read the bullet point very clearly, the task very clearly. Yannick says, I'd like to tell what's going to happen first. First of all, you will have to meet your surgeon and he will explicitly let you know how the procedure will be done, the benefits, the probable complications and the outcome. You will have to undergo further tests, all right? Okay. Your results are encouraging. That's Cynthia. However, chances of complications are slim, and I assure you that you are in safe hands. Okay, okay. Yeah. Christy says your results from the screening tests are okay. Nothing to worry about, as all precautions would be taken, and you come out of the surgery without any complications, all right? Yes, yes. So you're trying to reassure. Now, I don't want to focus a little bit more about reassuring because that's another topic altogether. But having said that, I can't skip that either, because don't be too much focused on, don't worry, I can understand your concern and all of that. Even without saying all of that, you can reassure the patient, right? So that's very important. And Dharan Kumar says, yes, Ms. Rose, I understand that you are a bit anxious about your screening test results, but let me reassure you that all your test results have been carefully reviewed by me as well as my senior. So please feel relaxed. Yeah. Now, probably you are, typing on a cell phone, that's fine. But in the real OET scenario, don't overload all the information together. You'll have to do it in chunks, which is another topic, chunking and checking and all of that. But I want to focus a little bit on how would you summarize this as well, right? For example, we're running out of time. So I just wrap it up for you. I'll summarize it for you. But probably you have the whole role play card on the screen for you. I'll take you to the entire role play card here, which says, reassure is the task we were discussing at the moment. Then comes explaining and informing. So probably you can do it like this. All right. So I'm talking about the task which says reassure the patient. So probably you can say something like, well, I've noted the concerns you have shared about the possible complications from the surgery, but I'm happy to share with you the results from the screening tests, and they look very positive. So you don't have any indicators which have been flagged, and that's a good sign. So that should be reducing some of your worry and concern about the complications. And so I hope that makes you feel better. So you are summarizing, and is there something you want to know about the screening? Yeah. Right. So since I've already told you about the screening tests and the chances of complications, I'd like to move on to the diet, which is something which you wanted a discussion on, and it's very important that I talk to you about the special diet, the very low calorie diet, which is something formulated for reducing some of your body weight as well as the metabolic activity before the surgery, priming you for the surgery. So that's what I'm going to discuss now. And then you elaborate what it is. And then you do a quick summarizing at the end of that particular task. So I hope I've explained everything that you need to know about the special diet, and your questions have been addressed, I suppose. But do you have any other question about the diet before we move on to the next task? Something of that sort. Sorry, I'm not able to catch up with all your posts, but I'll definitely read all of that. So this is what I want you to do. You can use this role play card. It's from an upcoming OET practice book. So you can use it to practice with your teachers, with your friends, with anyone, so that another colleague, so that you can ace your preparation. And if you want to take screenshots, it's fine. If you want to come back, revisit the recording, that's absolutely fine. And get better at doing it. So it's question time. Quickly, I'll take a few questions if you have any. I know some of you have to return to work, and many of you have to juggle between work and your OET preparation in these really testing times. So I'd be happy to address any questions you have about OET speaking, and some questions which you would have been having on the back of your mind for a while before I wrap up today's session. So remember that structure is really important for your role play success, for your speaking success in OET, as well as in your professional journey as a healthcare professional. And so that includes all these stages which we have discussed today. Seema, it's difficult to get corrections. Yes. You can ask some of our expert teachers at IRS Group to help you with that. We have some special packages for speaking and writing practice as well. So that's one place where you can visit, and make sure you download our learning app. It's called IRS Learning. It's available in the Google Play Store. Or if you use a Mac or Apple, you can do it online at irslearning.com. Mahesh is asking, provide some phrases of empathy. I'll do that, Mahesh. Yes, I'll remember that in the next session. But remember, empathizing is more about trying to step into the shoes of the patient, and it cannot always be ready-made. Although I can share some phrases which might help as well. Okay. But it's generally about somebody says they have got a terrible pain which is affecting their work. So how would you empathize? You can probably say something like, I know it must be really hard for you to manage your work with the pain going on in the back of your mind and bothering you physically. I can imagine how hard it is, but I'll make sure that you have some medication which will ease the discomfort. Yes, Mahesh, we do have courses only for speaking and writing, which you can talk to some of our counselors as well. They would advise you on how to go about it. please tell me what you have to do to complete according to the task, like first and second, or can we arrange according to the scenario, like assessment? Absolutely fine, Dolly. If it is in a proper structure, it's absolutely fine. There's no hard and fast rule that you should follow the task exactly in the order as in the role play. But having said that, typically the order of the task would be the ideal scenario as well. So remember that. But it's okay to move between similar tasks. Due to lack of time, you can't finish all the tasks. Is it okay to summarize all together? Certainly, at the end, you need a pretty decent summarizing, but the summarizing as you go on is a brief summarizing. Of course, you can summarize everything at the end of a task. Absolutely, that's an ideal thing, and it's perfect. Mahesh is asking whether the warm-up session is going to affect your marks. No, it's not going to affect your marks. You will not be assessed on the warm-up. Right. Sometimes treatment options are provided at the end. Dolly, generally, information giving tends to be towards the end rather than at the beginning, because that could be the reason why in a particular context, in a speaking task, you found treatment options at the end. And if you ask me if we can arrange it, it depends on how we are going to arrange it and how it fits in the sequence. So if it's going to disrupt the sequence in a big way, I'd say no. But if you can seamlessly blend in, that would be fine, perfect. It depends on how you do it as well, rather than having very strict rules. So that's what we were discussing about, the flexibility. You need to because a lot of things do come in. Patients will ask you random questions. Patients are not aware of the structure. Nobody would have told them like the structure, and that's why you do that at the beginning. But still, sometimes they might ask you other questions as well. So I have to wrap up now. Thank you very much, everyone, for attending this session, and I hope this is going to transform your OET preparation as well as your clinical communication skills. It was a great joy to chat with all of you, and gives me great happiness and satisfaction and gratification to be able to help all of you in these difficult times, the middle of this pandemic. So stay safe, all of you. Good luck with your preparation, and I'll see you soon with another session. So thank you very much, everyone. Thank you so much.